Hey guys, I want to talk to you a few minutes today about breathing patterns, abnormal breathing patterns in particular. But before we start, I have a question. When you came into the room, how many of you were thinking about your personal rate and depth of breathing? How about right now, how many of you are thinking about your rate and depth of breathing? Any hands? Because I can't see if you're raising your hands or not. And yes, I'm in my car. So, this is a depiction of a normal respiration rate, 12 to 20 breaths per minute for your average adult. This is a depiction of what we would call bradypnea. Normal. Bradypnea. Bradypnea is when breathing rate drops below 12 breaths per minute. This may indicate neurological or electrolyte disturbance, an infection. It may be a protective response to pain of pleurisy, or this could be an example of splendid level of cardiorespiratory fitness. Normal, bradypnea. Now we will move to tachypnea, which is greater than 20 breaths per minute. This may occur with pain, anxiety, ascites, or hepatomegaly. Normal, tachypnea. Next, let's look at a representation of hyperpnea. Normal, hyperpnea. This is when breathing increases to greater than 20 breaths per minute and includes deep breathing. This can be caused by exercise, anxiety, and CNS or metabolic diseases. Hyperpnea may result in hyperventilation. Again, normal, hyperpnea. Our next representation is of Kussmaul's. This is obviously a rate that is in the category of tachypnea or even hyperpnea. The distinguishing factor here is not only is it rapid and deep, it is also labored. This is most often associated with respiratory acidosis. Moving from Kussmaul's to Cheyne-Stokes. Again, let's reference normal and Cheyne-Stokes. This is characterized by varying periods of increasing depths interspersed with apnea. As you can see here, apnea, no breathing. This occurs in patients who are seriously ill, particularly with brain damage at the cerebral level. However, this can be a normal breathing pattern in children or older adults during sleep. And finally, BIATS. Normal representation of BIATS. Similar to Cheyne-Stokes in that it is irregularly interspersed with apnea. However, its sequence of breathing is disorganized. As you can see with the representation of Cheyne-Stokes, there is some repetition in the pattern of breathing. Here, not so much. And this usually is due to increased intracranial pressure. Let me say that again, intracranial pressure or damage to the medulla. And I will leave you once again with our normal representation of a normal, our representation of a normal breathing pattern. Thank you.